All right, pharmacist interventions part 10. Another intervention that I make for some patients are patients picking up fluoroquinolones, usually elderly patients because they're more at risk for side effects. Ciprofloxacin, levofloxacin medications like this are used for bacterial infections, namely UTIs, maybe sort of respiratory infections, skin infections, spontaneous bacterial peritonitis, stuff like that. So they have a lot of warnings with them. They have a risk for CNS effects, confusion, sort of dizziness, peripheral neuropathy, and then tendon rupture. Tendon rupture is very dangerous. You need to stop it if you have pain in your, tendons, like your ankle. The risk goes up with age and also with concomitant steroid usage. The FDA issued a safety warning due to the risks with the antibiotic, stating that it should be reserved for patients that have no other treatment options. So this intervention that I make is specifically for patients who are like first-time users of this. This is usually from teledoctors for like UTIs. So there's no culture, there's no sensitivity, it's just thrown first line. So I counsel them on the side effects and possibly maybe considering a safer option. Another intervention that I make a lot is for patients who pick up clopidogrel, which is Plavix. It's an antiplatelet. It's used for secondary prevention after someone's had a stroke, to prevent reoccurring stroke, and then also it's used after someone's had a myocardial infarction and a heart attack, and say they had a STEMI and they got a stent. It's recommended to be on an antiplatelet for a year per AHA or American Heart Association guidelines. So this is for those patients that are picking up this and Prilosec or omeprazole. Omeprazole is an acid suppressor. It's used for GERD, Barrett's esophagus, acid reflux, supposedly short term. But it is a CYP2C19 inhibitor. So it inhibits the enzyme that clopidogrel uses to get oxidized to the active form. This active form over here is the actual structure that via the thiol group binds to where it needs to go to block the receptor and sort of inhibit platelet aggregation. So if you take Prilosec, or for patients who have a polymorphism, a genetic polymorphism of 2C19 who are poorly functioning or underfunctioning, they should be well aware of this interaction. So I recommend maybe switching to something like Protonix that is not as heavily CYP mediated through that same enzyme. A third intervention that I make is for patients who are scared to inject their Lovenox. I'll do that for them. I had a pregnant patient who's terrified of needles. I told her, like, come in every day. I'll give it to you every day. She came 2 days in a row, and eventually I taught her caregiver how to administer those injections. That's a third intervention that I make.